Good morning, everyone. Today I'll be giving you all a tour of the Museum of Human Diseases, particularly focusing on lung neoplasms, or more colloquially known as lung tumors. Lung tumor is an umbrella term that loosely refers to a family of abnormal mass of tissue that resides in the lung. Some of them may have the ability to invade and spread to other parts of the body, which is referred to as malignant tumors or cancer, and they may be confined in space, otherwise known as benign tumors. As we navigate through this virtual tour, you'll know that there may be many causes of lung cancer. Before going into each individual specimen, I would like to tell you a little bit more about the lung. The lung is located in the chest, and there are two lungs in a healthy person. They are mainly involved in removing carbon dioxide and bringing oxygen in, but also in expelling bacteria and virus, as well as regulating pH. Naturally, there are fissures in the lung that separates the lung into two and three lobes in the left and right lungs respectively, as seen in the picture above. However, it is important to appreciate that variation can happen between different people. A healthy lung should look reddish in color and feel very spongy. After the technicians handle the specimen and store them, there might be some mild discoloration and change in texture, which is absolutely normal. Black spots can sometimes be found in the lung due to carbon deposition, which has been becoming more and more common to the environment we live in and the sort of pollutants we are exposed to, but is much more obvious and severe in smokers. Air flows into the lungs via strong cardiolatinous tubes called the trachea, which branches off into continuations of the trachea into the bronchus and the bronchioles. Eventually, they will this air will flow into the terminal air sacs, called alveoli, as we progress downwards, as shown in the diagram above where the arrows indicate the direction of airflow. The alveoli are where the gas exchange actually occurs. The lungs are surrounded by two layers of membrane, namely the visceral, which is in contact with the lungs, and the parietal pleura, which forms the lung cavity and basically lines around the uh, lungs cavities. Without further ado, let's jump into the first specimen of the day. The first specimen I've prepared for everyone is the following specimen that shows the right lung of a 51-year-old man that had a cough for over 30 years. Starting 2 years ago, he experienced progressive shortness of breath. 6 months ago, he started coughing out stuff, sometimes with blood, lost 10 kilograms of weight, and has chest pain in the right side. The type of the cancer that is presented is called squamous cell carcinoma. Carcinoma in general refers to a type of cancer that starts from cell that lines the organ or body cavities. And squamous cell carcinoma refers to a specific type of cancer that originates from the cells that line your body surface, including your skin and your airways in this scenario. Let's start off by considering the area demarcated by the space blue and green lines, as shown here. The space blue area contains the upper lobe of the lung, whereas the green area indicates the middle and lower lobes which are collapsed in this case. The color of the space blue region is a dark red tone, which in contrast to the green area that takes on a grayish pink hue. One thing that both parts have in common is that they are speckled with black dots, which are the carbon deposits we have previously discussed. What is also visible here in the green zone are these small speckled pale pink aggregations, which looks relatively solid and embedded within these small sacs. These are called pus, which are collections of dead cells and bacteria. And then here, these are combined with the mucus produced by cells in your lung, which is meant to trap the nasty pus and allow you to cough out the harmful microorganisms that exist within the pus. But in this patient, because his bronchus is so obstructed by the lung tumor, shown by the area encircled by the red lines, they cannot be cleared efficiently and quickly. As a result, this collection of pus and mucus stays behind, gets trapped in the air pockets, causing infections within the lungs, called pneumonia. The infections and the subsequent body's response to try and get rid of the infections causes repeat injury to the lungs, and when the body tries to heal it, it lies down new tissue that is no longer the same as the original ones. This contributes to the pale area color that's outlined in green, which in contrast to the relatively normal and healthy lung tissue in the space blue region. Moving on, let's consider the area encircled in red. This is where the cancer originated, and you can tell it looks very, very different from the normal lung tissue. It looks much more solid, and the color is quite different as well. The cancer measures around 6 centimeters in diameter and has severely obstructed the bronchi that leads towards the lower and middle lungs, which, as you would imagine, would cause a lot of difficulty for the patient to breathe, especially when he's exercising or when he's moving around where he would need more oxygen to supply his muscles with energy. And this obstruction is also what caused the collapse of the lower and the middle lobe. And as a result of the lung cancer occupying the bronchus, the patient will feel irritated by a constant feeling of something in the airways and would have worsened his cough. However, the right lung is still relatively functional because the upper lung is still fairly conserved, which means that it can still work as usual. With cancers, which is basically a bunch of cells that grow uncontrollably, they take up a lot of nutrients. Therefore, there will be an increase in the body's demand for nutrients, explaining the weight loss. The tumors also have many blood vessels within them, because more blood vessels allows them to receive more nutrients, and this leads to faster growth. These new vessels, however, are very fragile and can be injured very easily, and causes blood to leak out and infiltrate the airways, and the patient will then cough out these blood. In addition, the lung also has a very rich blood supply from a plexus of tiny blood vessels. These blood vessels can also be invaded by a tumor and can rupture, which would lead to the patient coughing out blood. Right next to the tumor surrounding it are the few circular nodules that are blackened. These are lymph nodes blackened with carbon deposits, but also infiltrated by the tumor cells. Lymph nodes are organs within the lymphatic system. The lymphatic system can be seen as another set of blood vessels, which aims to mobilize the immune cells within the body, which are then suspended in a bed of fluid made from plasma. Once these lymph nodes are invaded with cancerous cells, there's a chance that these lymph vessels will spread the cancer cells all around the body, causing them to invade organs including the liver, brain, or bones, which is known as metastases and a very important marker of how deadly or severe the cancer is. Rarely, these cancer cells, when large enough, can also spread through the blood vessels and can lodge in blood vessels that can block blood flow to that place. In the brain, it will lead to stroke, and in the coronary arteries, or small vessels, blood vessels that supply the heart with blood, can lead to heart attacks. Luckily for this patient, the cancer did not spread through the lymphatic system, and he had an uneventful recovery upon removal of the entire right lung. Let's jump back for a moment and take a look at lung cancer in general. There are many subtypes of lung cancer, but in general they can be separated into two categories: the small cell lung cancer and non-small cell lung cancer. As the name suggests, non-small cell lung cancer basically encompasses the type of cancers that are not small cell. And as you may wonder, what is small cell lung cancer? Well, small cell lung cancer is any type of lung cancer that when examined under microscopes looks small and resembles like oats, like this one. Non-small cell lung cancer can be grouped into different subtypes based on how they look under the microscope, or histology. This is important as different tumor classes can have a huge impact on the treatment. There are three major types of non-small cell lung cancer, which includes adenocarcinoma, squamous cell lung carcinoma, as we have discussed previously, and also large cell carcinoma. Adenocarcinoma arises from secretory cells or glands, and large cell carcinoma arises from any part of the lungs. It tends to spread very quickly and most likely contains a combination of both adenocarcinoma and squamous cell carcinoma. As I've mentioned before, looking at these lung cancers under the microscope is quintessential to reach a definitive conclusion of what type of cancer this is. because the symptoms can be quite generic and basically depends on the site of obstruction. When we look at these cells under the slide, they might look something like this. Taking squamous cell carcinoma for an example, we can see that these cells are poorly arranged, with concentric circles made with keratin, that is the same protein that makes up our skin. These individual cells, as circled by here, or here, looks like polygons, and these are actually connected with each other, which is very typical of squamous cell, and is also very important when we're diagnosing squamous cell carcinoma. Next off, I'll be talking about mesothelioma and small cell carcinoma in this talk, so it will benefit us if we discuss some of the histological features of these tumors. And histology refers to the look to observing cells under a microscope. Let's start off by looking at mesothelioma, which is here. We can see the cells are quite elongated and they look spindle-like. They are arranged in very poorly defined bundles, and the major diagnosis, however, is through staining with the special substances or molecular markers. Whereas small cell carcinoma looks quite different from squamous cell carcinoma and mesothelioma. These cells are very, very small, like oats. They are quite granular when we're looking at these individual cells, and basically this granular appearance basically obscures the cell's shape. The following chart shows how non-small cell lung cancers can be graded from 1 to 4 using the TMN protocol or the tumor, lymph node, and metastases protocol. To simplify things, the higher up the stages, the higher tendency the tumor is already spread from one place to another, which could be the lymph nodes or other organs. At stage 4, the cancer will spread to other parts of the body and form new tumors. And this, as you recall, is called metastasis. For instance, by judging at the image we were given of this patient, the cancer is 6 centimeters wide, and there is some infiltration into the lymph nodes. Therefore, the best estimate of the staging of the cancer is stage 2B, because it has spread into the lymph nodes within the right lung, and is between 5 to 7 centimeters long. As we have discussed previously, carcinoma is an umbrella term that encompasses cancers that arises from cells of the lung. There are many different cell types of the lung, which give rise to the diverse array of potential carcinomas. Therefore, it should not surprise you that carcinoma and its family of subtypes contribute to around 90% of all lung cancers in Australia, of which 64% are non-small cell lung cancer and 20% are small cell lung cancer, as 20% are squamous cell carcinoma, as shown in this table published in 2007. Perhaps the most well-known cause for any type of lung cancer would be tobacco smoking. The more cigarettes and the longer you smoke, the more likely you are to get any type of carcinoma, especially large cell, small cell, and squamous cell carcinoma. Other causes of carcinoma includes having a family member that has cancer, especially your parents or siblings, which indicates some degree of genetic predisposition. If you have previous lung disease that caused damage to the lungs, and air pollution, for instance, secondhand smoke, and car gas. Radon gas, a naturally occurring radioactive gas produced from compounds that decay spontaneously, is identified to be the second leading risk factor for lung cancer, but is not as important in Australia as the concentration of radon gas is not that high. Certain carcinomas are also more frequent in different groups or demographics. For instance, squamous cell carcinoma is more common in men, whereas adenocarcinoma is more common amongst women and non-smokers. Another risk factor which we will be going into a bit more detail would be the exposure to industrial pollutions, such as asbestos or metals. So, here we have in front of us is a much rarer type of cancer called mesothelioma. The specimen comes from a 66-year-old male miner with a long history of lung diseases and has been exposed to asbestos for an extensive amount of time because of his occupation. Let's start by orientating ourselves. This specimen is taken if we were to cut the lung in half horizontally. Surprisingly, this picture does not contain any lung tissue. All that is visible in front of us is a tumor that has been encasing the left lung, which is not visible in the diagram. It is approximately 10 centimeters in diameter. If the whole lung is presented, you will not be able to recognize it at all, because the lung will be covered by a huge sheath of tissue, which is the mesothelioma. The cancer, when it happens in the lungs, develops as small individual nodules, which coalesces into a sheet that encases the lung eventually. It thickens as time progresses and eventually becomes like a cheese rind. The cross-section of the specimen in general looks very pale and white, which is not what we are expecting if this is a lung, which should be red, vibrant, and fleshy. Let's take a look in more detail at the fake white spherical structures that contains a creamy brown white center in the center of this lung tumor. This creamy brown center is part of the lung cancer cells that died. As you can imagine, with a cell this big, the demand for nutrients would be extremely high. Because the blood vessels run superficially in this specimen, as we can see here, these of almost fatty-looking structures are actually the blood vessels. They run superficially in the specimen, and the cells in the center will be relatively deprived of nutrients, which causes them to die. When we look at the specimen from behind, we can see some pink tissue, albeit it's quite hard to distinguish from the pale white tumor. The pink tissue is likely to be part of the lung, which has undergone many processes of trauma and subsequent healing. The patient was extremely breathless. Can anyone guess why? Imagine your lung being trapped in a cage which prevents it from expanding. This prevents your lungs from getting air in, and the patient would be basically relying upon his other lung for a gas exchange. The physical presence of the huge tumor would also compress on surrounding organs located within the chest cavity, which includes the heart and the other lung. This further impairs the process of gas exchange, accentuating the shortness of breath. Furthermore, its pressure can also be applied to the heart, which makes it difficult for the heart to pump efficiently, and this would result in heart failure, which is basically when the heart fails to work properly. Another symptom that the patient presents with is called clubbing of fingers, which is shown in the diagram on the right-hand side, and it's quite typical of lung cancer, and the reason for this is still relatively unknown. The patient unfortunately died shortly after hospitalization due to an episode of uncontrollable muscle spasms, which is known as convulsion. Mesotheliomas are actually very rare, because mesotheliomas are derived from cells that line the body cavities and can happen in other areas, such as the abdominal cavity and even around the heart. However, over 90% of mesotheliomas happen in the lung. Approximately 700 to 800 people are diagnosed each year in Australia, and it's almost exclusively caused by inhalation of asbestos for an extended period of time, usually above 20 years. These asbestos fibers will damage and induce changes in the DNA of the lung cavity of the body cavities, which will lead to the formation of mesotheliomas, and is often malignant. The survival rate is very low because oftentimes when it is detected, it is already quite advanced. It is also very aggressive and tends to spread to other parts of the body readily. This specimen is an exception, as it does not spread to other parts of the body and remains relatively confined. Regardless, the patient still died from this, which indicates that whether it has metastases or not, is not really indication of how deadly the tumor is. Also, an important thing to notice is that although lung mesothelioma happens in the lung cavity, it is not classified as a lung tumor by convention, as the origin of the cancer is at the lung, rather than the membranes that cover the lungs, which is the parietal pleura. Finally, we will be looking at a sample of a small cell carcinoma. Looking at the image below, let's start by orientating ourselves. In front of us, we have the right lung, of a 54-year-old female whose part of the upper part of the lung is resected to show us the interior of the lung. Now, the specimen actually looks quite similar to the first specimen we just had, and by looking at it based on the color and the location of the tumor. Again, let's start off by examining the normal part of the lung, which is shown here, and and you can see that the whole lung basically is either slightly pinkish in color or is relatively gray as circled by this white circle. There are also many specks of black dots that are scattered evenly across the lung, which indicates that the lady is probably a smoker, a regular smoker. In fact, squamous cell carcinoma is a type of cancer that is most associated with smoking. The risk is approximately 21 times higher compared to a non-smoker. And then we can also examine the part of the lung which is which is encircled by the tumor. You can see that it pretty much occupies the center of the chest, and it would be located in where the bronchus branches off. And this pinkish white thing is the cancer. It is approximately 5 centimeters times 6 centimeters long, and it's quite massive. Judging from this image, it is possible that most of the airways of the right lung are blocked by the cancer tissue, and the patient would have difficulty breathing. However, unlike the first specimen that we saw, it's quite different in the sense that the cancer is actually invading into the surrounding lung tissue. And we can see that some of this normal lung tissues have been replaced by the cancerous growth as shown here. Also, almost the entire bronchus is obstructed, which is different from the first specimen where the upper bronchus is relatively spared. And this blockage of the tumor to the air sacs is what caused episodes of pneumonia in this patient, which is basically infections of the lung. And the body's repair process is what caused the lung to look relatively grayish. Furthermore, the cancer is also seen to be growing into the lymph node, as circled here. This meant that the cancer cells can disseminate and travel through the lymphatic system, spread to different parts of the body. And indeed, the cancer in this patient had metastases to many regions, including the vertebrae, the pancreas, the liver, and the adrenal glands, which sits above the kidneys. These metastatic cancers can be asymptomatic, which means that they can not show any symptoms. For example, in the lung, in the liver, or in the pancreas, because these organs can operate even when most of the tissue is dead or non-functional. However, it can also have severe manifestations. For instance, in this scenario, the layer of the membrane that covers the spinal cord is being infiltrated, which led to a tumor growing inside the tiny canal that hosts the spinal cord. The spinal cord contains many nerves that controls the body's movements and sensation. It's basically an extension of the brain, so when it is compressed, the signals that allow the brain to communicate with the body is severed. The patient is unable to move her right side of the body, as well as not able to feel anything below the chest as a result of this cancer. Another thing that happens with lung cancers is that it puts the patient at high risk of accumulating fluid in the lungs. The lungs normally does not occupy all of the chest. There are these potential spaces called the pleural cavity, which is only occupied when the lung expands maximally. And this pleural cavity can be filled with fluid, and normally there will be some fluid there just to lubricate your lungs. However, it will by no means get overwhelmed with fluid. The way the tumor is able to make your lungs filled with fluid is by making more blood vessels, as we mentioned before, and also by making the blood vessels in the lungs more leaky. By doing so, the plasma, which is the fluid part of the body blood, can leak out and seep into these spaces. This will compress the lungs significantly, causing severe deep pain around the chest, as well as unable to breathe. An interesting fact to note is that the ability of a tumor to make the patient's lung fill with blood, with fluid, is an indicative factor that the patient is likely to have a poor outcome. In this patient, 1.5 liters of fluid was extracted by pulling a needle into these spaces. This fluid is also a great breeding ground for bacteria, and similar to the first case, because the bronchi is so obstructed, the patient also has pneumonia, which led to the formation of pus, as I mentioned previously. The staging of small cell carcinoma is not exactly the same as we have discussed previously. However, it can also be named according to the TMN system as well. Clinically, the extensive versus the limited stage is used more often. Simply, if the tumor is confined to one side of the lung, it is considered to be limited, and anything beyond that is known as extensive. As you can see, all three cancers may look quite similar in the first glance, but in reality they can be quite different depending on their subtypes, the stages, as well as impacted by their own health. This is going to impact the outcome of the patient's treatment, as well as the principle of treatment. Therefore, reaching a correct and timely diagnosis is very, very important. To diagnose the patient, a doctor would need to look at the symptoms and the background of the patient, as well as examining the patient physically. If the doctor considers cancer as a diagnosis, they will order tests which can include an X-ray, scans, blood tests, etc. The main symptoms a patient might present with would be chest pain, coughing up blood, difficulty breathing, cough, weight loss, loss of appetite, night sweats, and also clubbing of the fingers. If they have confirmed that a cancer is present, they will need to take a sample of the cancer out through bronchoscopy and send it out to pathologists who would apply chemicals and look at the cancer cells under a microscope in greater detail to diagnose the particular type of cancer. This would allow the doctors or surgeons to come up with a treatment plan along with different medical professionals such as radiologists and pharmacologists. The treatment may include surgery to remove part of the lung that contains a tumor or an entire lung, use radiation to kill the tumor cells and let them shrink, or inject chemicals into the patient's body, which will kill the tumor cells as well. Usually, a multitude of these treatment modalities will be used. Still, lung cancer is one of the deadliest cancer and is very important for people to cut down their smoking habits because smoking alone is the greatest risk factor for developing cancer and is one that can be altered. Thank you everyone for going on this journey with me, and I hope everyone leaves here today with a better understanding of lung cancer. Stay safe and enjoy the rest of the day, and this is the list of references.